Hello, my name is Teresa Sanderson. I'm a registered nurse certified in hospice and palliative nursing, and I serve as CEO of Abundant Life Hospice of Northeast Kansas and Southeastern Nebraska. Today I would like to talk with you about heart disease. Heart disease is now the third leading cause of death in the United States. Because we have a population that is 13% higher than the rest of the country in people who are age 65 or higher, and because hospice has consistently been 30 to 35% of the hospice patient census at Abundant Life Hospice, it's important for us to discuss this illness. Typically, a patient with heart disease who may be entering the time frame to make a referral for hospice will begin to have sort of revolving door types of admissions into the hospital, multiple admissions in 1 year related to heart disease and typically for the same symptoms. What you tend to see is that your patient will have an exacerbation of their heart disease. They will be admitted to the hospital for a period of days or weeks. We do a medical tune-up, get them back into fair shape, probably not the shape they were in prior to admission, and then we release them back to the community. They do well for a period of weeks or months, later have the same type of exacerbation of symptoms from their heart disease, are readmitted to the hospital for a period of days or weeks. We give them a medical tune-up again, and they are released back into the community, and the cycle continues. What's important to note in this cycle, though, is that each time your patient is released from the hospital, they do not regain their prior level of health or function. So in spite of the best medical care, in spite of our aggressive medical treatment, the patient continues to decline throughout this cycle. This is a great example of a patient who may benefit from hospice care. It's important for us to consider that while hospitalization may give them a tune-up and get them feeling pretty well, what are the trade-offs? How many days are they spending in the hospital? Are the procedures invasive? Do they have IVs? Typically our aging are hard venipunctures and hard to place IV lines and those types of things. So it's just important to consider what is the benefit of treatment, what is the burden of treatment, and are there opportunities possibly for this person to remain in their home. Other indicators that your patient may be approaching the need for hospice is that they just continue to decline in spite of optimal treatment for coronary artery disease or CHF. The patient is not a candidate for surgery. Your patient declines treatment. Those patients who have orders that say do not hospitalize or comfort measures only are crying out for their wishes to be known. If you have heart disease patients with those types of orders, the time is right to clarify. What does that mean to you? Do you want more hospitalization? Are you interested in knowing about a type of care that would allow you to stay at home with all the care and support that you would need? And if they are, then the time to refer to hospice is now. Classic stage 4 heart failure. Your patient experiences shortness of breath or angina at rest. This is the admitting criteria, standard admitting criteria for heart failure patients to hospice. So keep this in mind as you work with your patients with heart disease each week. I hope this is helpful. Please feel free to email me your comments or your questions, and have a great week. Bye-bye.